Mr. Speaker, I recently held a forum to discuss with Manitobans whether coverage for psychological services should be enhanced under Manitoba Health. Limited psychologist services are covered now at institutions, but these same services critical to mental health are not covered for psychologists with offices outside of institutions. Experts have shown strong support to enable people with mental health issues to get coverage for psychological treatment under Manitoba Health, as the document, An Imperative for Change, shows. I asked the Premier, why is the government limiting access to psychological services by not covering them under Manitoba Health, as the document I tabled says should be done?
Thank you, Mr. Speaker. We opened the first crisis response center in Canada for people with mental health issues that need to be addressed. And that center is world class. It's got all kinds of health professionals in it, doctors, nurses, psychiatrists, all the services that people need. And it's unique in that it provides a one-stop shop for people that are experiencing issues with respect to mental health. And Mr. Speaker, we're very proud to see that opened up. I was fortunate enough to be there for the opening, saw the people there, saw their dedication to service, saw the nonprofit organizations and the community organizations that were working with them, and they were delighted that we had put this resource in place, Mr. Speaker.
Mr. Speaker, I have invited Dr. Andrea Piotrowski, who's the President-elect of the Manitoba Psychological Society, to be here in the gallery today, and she is. She has expressed very strong support for additional psychological services for children to be covered under Manitoba Health. One grandmother wrote to me about the need for her granddaughter's psychological care because she was depressed and had suicidal tendencies. Her coverage under a private insurance plan would soon run out. This woman is very fearful for her granddaughter. Will the Premier consider covering all psychological services for children under Manitoba Health?
Again, Mr. Speaker, with respect to the specifics the member has identified, if you bring that forward to the Minister of Health, we'll definitely look into that. We have put resources in place. We have put resources in place to address mental health prevention issues. We put specific investments into our public schools, Mr. Speaker. One of them is our good behavior game, which has been recommended to us as a game that teachers can use working with young people to improve their resiliency in terms of the issues they have to experience in terms of stresses in their life. We've provided very significant funding to our public schools, including the clinical services that we put into our public schools, including psychological services, Mr. Speaker. We remain open to looking at other ideas on how we can improve and prevent stress that cause mental health issues with young people, as well as youth, as well as adults, Mr. Speaker. We have a suicide prevention program in Manitoba, and now, for the first time ever in the history of this province, we have a mental health court. And that mental health court has been quite successful now because it provides not only a point of intervention within the legal justice system, but support services from the healthcare system as well, Mr. Speaker.
Mr. Speaker, psychological services are of critical importance to treat postpartum depression. I table the results of a randomized controlled trial, which shows that for women with postpartum depression, intervention is a better option than routine care. Successful treatment with psychological therapies is not only effective, it also reduces overall health care costs. It's vital that people with mental health challenges have access to this type of care. Knowing this, will the Premier include psychological services by psychologists for depression and anxiety under Manitoba Health?
Mr. Speaker, the member raises important issues with respect to the health of young parents in Manitoba, young mothers in Manitoba. Our Family First public health nurse visits ensure that every new mom is contacted by a public health nurse after they leave the hospital to offer support and advice. And they are a part of teams that can provide additional services as necessary for folks. But we recognize the value of supporting families, young families, when they get started with the responsibilities of being parents. And we know that they need additional support. And I can only say this, Mr. Speaker, we've put additional money in every single budget to support young families in this province. The member asking me the question has never voted once for those additional resources in our budget, Mr. Speaker.